Professor Arsen D from the Department of Cardiology of Clinical Center of Serbia and Belgrade University Medical School. It was a great pleasure to take part as a speaker at the International Symposium, RISTIќ Crossroad, dealing with diabetes, coronary artery disease and heart failure. Topic of my presentation at the meeting was very important, the critical condition in the emergency medicine, which is a combination of acute heart failure and acute coronary syndrome. So the most complex patients that are simultaneously presenting with two critical conditions and that should be treated promptly. We now have new guidelines published by the European Society of Cardiology just a few weeks ago, dealing with patients with acute coronary syndrome and presentation with ST segment elevation, so the most complex patients with acute myocardial infarctions. And we of course have, as a large referral center, long-standing experience with this subset of patients. There are some new recommendations how to treat those patients, and we should do this promptly in order to enable them to survive this condition and to be able to get appropriate treatment, addressing for the most importantly prompt revascularization, and at the same time treating heart failure. So management of congestion and simultaneously with life support systems, with mechanical circulatory support, with the proper selection of medications, and of course with the proper and prompt revascularization. It's especially important for diabetic patients, and diabetic patients have some specificities regarding they have different type of coronary artery disease. Coronary artery disease in diabetic patients is more complex, it's diffuse, blood vessels are small, so we frequently need several stents to manage those patients, or the cardiac surgeons should do prompt emergency revascularization. So diabetic patients have their specificities, not only regarding revascularization, but also regarding their medical management, and those topics are important. Level of glycemia in this acute condition is important, and these were the points from my presentation yesterday.